Okay. Let me know when you guys want me to start.
Okay, we're live now.
Yeah?
Yeah.
Okay. Great. Hi everyone. Welcome to Fresh Dental Shadowing. My name is Dr. Sarah Chung, and I am a periodontist practicing in Los Angeles, California. And I'm not sure if any of you guys are interested in applying to perio residency, but if you are, this will be helpful to you. So table of contents, so the things that I'm going to be discussing is my educational background, my specialty, which is perio, and why I decided to go into periodontology. And we'll talk about some tips on applying to a postdoctoral periodontal program and some dental school tips. And what my day-to-day life is like in a periodontal practice and my workday as a periodontist. And I can showcase some procedures that we do pretty often and I really like doing, which are aesthetic crown lengthening and root coverage through Vista. So my education, I received my Bachelor of Science in Biology in University of California, Irvine, and I obtained my Doctor of Dental Medicine degree from Tufts University School of Dental Medicine. And then I also went to University of Southern California for my perio residency, and I received the certificate of graduate studies, and I also have a master's pending from my research from the same institution. And the reason why I wanted to go to Tufts was because I grew up in Southern California and I even went to college here too. I actually had a chance to visit Boston for a research conference when I was attending UC Irvine. And I really fell in love with this city. So after I interviewed there, I decided to go there. And then after staying in Boston for 4 years in dental school, it was so cold and I missed my family in California. So I came back to Southern California. And in terms of scholarships, in dental school, I had about $10,000 from a merit-based scholarship during the 4 years. It wasn't much compared to the whole loan amount, but it still made a difference. So my specialty, as you know, I'm a periodontist. For those that are not familiar with what a periodontist does is periodontist is a dentist who specializes in the prevention, diagnosis, and treatment of periodontal disease and in the placement of dental implants. And we complete 3 extra years of residency or training after dental school. And we treat more problematic periodontal cases, such as those with severe gum disease or patients with a complex medical history. And I decided to specialize in perio because I worked for a periodontist during my gap year between college and dental school. And in perio, in dental school, I was interested in specializing in perio, and I was part of the Tufts Advanced Selective for Periodontics, and we were exposed to some periodontal surgeries, and we got to do some surgeries on the pig jaw. So, why perio? I kind of discussed that a little bit. I really enjoyed the surgical part of dentistry. I also had an amazing mentor who was my clinical faculty in my group practice. Her name's Dr. O. She really, really inspired me to become a periodontist, and she helped me also become part of the advanced selective periodontal program during my 4th year in dental school. So applying to a postdoctoral periodontal program for the prerequisites, you need to have your national board exam scores. You also need to have a dental degree. You need to have your dental school transcripts and also from college as well. You need 3 letters of recommendation, and you need to have TOEFL scores for foreign trained dentists. And then GRE, research background, AGD, GPR. Some programs consider these, but not all of them. So the application process involves a candidate who is interested in specialty programs, and you should really know what they would like to pursue by the end of their third year. So the first bullet point is not a hard and fast rule if you're planning to work as a general dentist in private practice after dental school or do an AGD or GPR program, but you should really know what specialty you want to pursue by the end of your third year so you can prepare yourselves for applications and interviews and such. And you should choose about 10 to 15 programs you are most interested in and determine the application deadlines. And make sure that your letters of recommendation are favorable. I've heard of horror stories of certain dental students or even interns. They receive bad letters of recommendation, but they are not aware of it until the application process is over. So you need to really make sure that you are getting good letters of recommendation and that people or your letter writers aren't writing bad things about you. And you can find all of this information on perio.org. I put the link there for anyone who is interested. And so starting from, a couple of years ago, they decided that the postdoctoral periodontal programs were going to participate in the match. Basically, what that means is you're matched to a certain residency. So basically, you rank a certain number of programs, and then the programs rank the candidates. So if you guys both match the program and the candidate, then you are going to that residency. There's some things that you need to consider before you apply to certain programs or rank certain programs in the match. But anyone who's interested in that, you can contact me via email. So, dental school tips. Seek mentors. So finding mentors is very important, whether it be your professors or mentors in private practice. My mentors have helped me so much, and it's good to see how that person got to that position and be where they are. Also, you shouldn't just befriend people just to get letters of recommendation, but to get letters of recommendation, but you need to have at least 3 letters of dentist. So you should really try to look for mentors if you can in dental school or outside. And you should really use your faculty as a resource. I was able to do that with my clinical faculties from Tufts. My periodontal faculty, like Dr. O and Dr. Ogata, they really helped me with my application and learning about perio in general. And for periodontal residencies, I definitely say research is recommended. I actually did have some research experience in my undergrad, so I was able to kind of talk about that during my interview. And if you do have research in your CV, your interviewers are definitely going to want to talk to you about the research that you conducted, and that they want to see if you published any papers or if you're co-authors on any papers. And definitely get to know the periodontology department. There's a high chance that you may end up at the same institution for your residency. So definitely befriend the perio department. They're going to definitely choose a candidate that they know very well than someone they don't really know, or someone that they only know from interviews. So if you're interested in going to the same residency at the same institution, I would definitely try to get to know the perio department. And the last tip is to finish the requirements early. For me, I was able to finish my requirements pretty early on in my 4th year. you kind of have to account some time for interviews. um, you're definitely not going to go to all of the interviews, but if you apply to a lot of programs and if you want to interview at all the programs where you got the interviews, I would definitely block out some time to make sure that you get your requirements done early so you're not rushed to graduate. So I have a private practice in Los Angeles, California, and I'm going to be starting my adjunct assistant professor of clinical dentistry and periodontology at USC. The reason why I chose Los Angeles is very practical. My husband is an oral surgery resident at USC. He still has about 2 years left in his residency, so we have to live very close to the hospital where he works. I opened my practice right outside of residency. In retrospect, it may have been a little foolhardy, but right now I'm in the building phase of it. So I'm trying to build up my periodontal practice. I'm trying to have a good referral base. And I'm trying to, just build my practice. And I did work as an associate dentist during residency. I think the important thing when you first finish dental school is that you get paid per diem in the beginning. For those that are going to work right away after dental school, you'll be slow at first when you first start working. So until you build up your speed, you get paid per diem. But after you get pretty fast, you can get paid based on production. Because your skill set will be expanding and your speed will also decrease. Workday as a periodontist, the daily procedures, it ranges from periodontal evaluations, scaling and root planing, crown lengthening, soft tissue grafting, impacted tooth exposures, sinus augmentation, bone grafting, dental implant placement. I do lots of consultations. Not all of the consultations end up in treatment. So I end up doing lots of consultations. I do perio checks for orthodontists, for patients who they think they have bone loss or some periodontal issues. So they just want to make sure all of that is controlled before orthodontic therapy is begun. So I'm going to talk about two of my most favorite procedures. So the first one is aesthetic crown lengthening, and this is a treatment for gummy smile. So a gummy smile is also called altered passive eruption. This is going to be a quiz question, so I'm going to say it again. So gummy smile is called altered passive eruption. And what that means is you have an active phase of eruption and you have a passive phase of eruption. So the active phase of eruption happens when after you have your primary teeth exfoliated, you have the permanent teeth coming in, right? And then once the teeth are in occlusion, the permanent teeth, the active phase of eruption is done. But after that, after a course of period of time, your teeth basically supra erupt. It doesn't happen as fast as active eruption, but it does happen at a pretty slow rate. So for this patient was 17 years old when she first presented to me, but she had altered passive eruption, meaning that the teeth did not come out fully as they should. So the gums look very bulky. She has very short clinical crowns. And the chief complaint for this patient was that her teeth are very small, but she was referred to me by an orthodontics resident because the orthodontics resident could not put on the brackets on her teeth. The brackets kept on popping off because of a small surface area on the clinical crowns. So if you look here on the molars and also the anterior teeth and also the premolars, kind of everywhere, she has a very short clinical crown. So what I did for this patient is I did a gingivectomy first. That means I cut the gum, and I wanted to kind of see what the optimal crown size should be. So if you look at the difference, this is after the gingivectomy, and this is just with the incision. This is how much I'm gonna cut off. You can see how big of a tissue I took from the gingiva to make sure that I have enough exposed clinical crown. So after doing this, I reflect the gum tissue, and then I do I do a osteoplasty and ostectomy, and that basically means um, I reduce the bone, and then I also shape the bone so that the gums can kind of fall onto the bony architecture really nice. I didn't include those pictures in the slides just because I wasn't sure if people would want to look at stuff like that. Some people are very turned off by the gory images, so I didn't share those. But if you're interested, I can share with you for the interested individuals. So basically, this is the before and after. If you can see, the patient has a very gummy smile appearance. The gums are very bulky, and the clinical counts are very short. And then this is about 2 months after the procedure was done. So you can see the patient has longer teeth, and her chief complaint was that her teeth are very small and short, so she feels like she has baby teeth. So she was pretty self-conscious about that, but she felt very confident, and she said that her self-esteem really rose up through the roofs, and she was really happy that the procedure was done because she felt like she looked more like an adult after the procedure was rendered. So this is an intraoral photo before and after. So you can see that the gingival margins are pretty bulky. We really addressed that issue for her. And you can see the gingival margin, so the gum lines, it's higher up now. So basically her teeth look longer and larger. And after this appointment, the brackets were put back on, and then she resumed her orthodontic therapy. And this is just another view of the before and after. You can see there's such a dramatic difference in the appearance of her teeth and her gums. And she resumed orthodontic therapy, but I don't have the photos after the braces were completed. And then this is a before and after. This is just a posterior view for both the right side and then the left side. So another procedure that I'm going to talk about is Vista, and this is a root coverage procedure that I did for this patient. And basically this procedure is done when patient has recession. So if you look here, the patient has suffered from localized gum recession or gingival recession. So you can kind of see that the gum line is supposed to be kind of higher up here in this area. I don't know if you can see my cursor, but basically the patient has had gum recession. So how we can treat this is through a root coverage procedure, and this is called Vista. Vista stands for vestibular incision. Vestibular incisions of periosteal tunnel access. So basically, an incision is made in the interproximal region of number 22 and number 21, and we raise a flap but underneath the gums. So basically with this periosteal elevator, what I'm doing is I'm separating the periosteum from the bone, but I'm not accessing this area by opening up the gums. I'm doing it through a tunnel incision that's away from the actual surgical site. So what I do here is I reflect all the way up to the sulci of the teeth so that the gums can be moved more coronally so that we can kind of coronally advance the gum tissue. So I hope this video plays. Let's see. No. Okay. Let me stop share for a little bit so you guys can look at the video. Sorry. Okay. It doesn't seem like the video is going to show, so let me just move on. Okay, I'm sorry about that, guys. So what I do is I take a piece of tissue from the tuberosity. The tuberosity has very fibrous tissue, and it is really good for procedures like this because it really thickens up the tissue and it prevents any further recession from happening. So once we coronally advance the tissue, it will stay like that and it will have a long-term success. So basically what I do is I take the tuberosity tissue and I cut it up. And then I put the tuberosity tissue underneath the underneath the tunnel that I've made, and then I also bring up this gum tissue, and then I suture it, and then I bring it up, and then put composite buttons on there. So during the healing time, the gum line stays right there. And then this is the suture photo. So with sutures, what I did was I'm using suspending sutures to kind of bring up the gum line and have it stay there during the healing period, as I said. And this is a tunnel laxus that I made, and then you still have to suture that because you don't want the gum tissue that we have grafted to kind of fall out from there. And you can use suture techniques called lasso suture to kind of stabilize and have the graft material stay in there so it doesn't move around during the healing time. So this is the before and after. As you can see, the patient had a lot of recession and it was aesthetically displeasing. However, after the gum graft was done, also the Vista procedure was done, you can see that the gum line has been restored to where it should be. And because we've also thickened up the tissue, it'll stay like this. So you can see the before and after the gum tissue around number 20, 21 and 22, and also 20, it's pretty thin, but after the procedure was rendered, you can see that the patient has thicker tissue, which will be beneficial for the patient. So actually, I thought it was gonna be a lot longer for the presentation, but and I also thought that video was gonna work. But do you guys have any questions for me?
Um,
Anything?
Hi.
Hi,
Hi.
yeah.
Thank you so much. So we can start with the questions now. So, where was your favorite part of being in dental school?
My favorite part of being in dental school, I think it was all the friends that I've made. I know it sounds kind of cheesy, but I really appreciated all the friendships that I made. I mean, obviously, dental school is very, very tough with all the sim lab sessions and all the tests. I think it was really good to have a good group of friends who I hung out with for studying and also practicing in the sim lab. So I think that was the best part.
So, what's your favorite part about being a dentist?
I think my favorite part about being a dentist is that you have immediate like a transformation for the patient. I think for surgery it's a little difficult. I mean, different, but because you kind of need the healing time for the outcome to occur. But with something like Vista, like the root coverage procedure, or even the aesthetic crown lengthening, you have immediate results. I mean, minus the healing time. So I think it's really beneficial for the patient, and the patient gets really happy after. So I think my answer is like immediate results.
How do you manage your work-life balance?
Oh man, I mean, I'm I'm actually a terrible person to ask that because I feel like I'm working a lot of the time. But I mean, I've been just so busy trying to build up my practice, trying to build up my referral base. So it's been kind of hard to kind of focus on myself. But I mean, before I like to run and I also did yoga, but I've kind of fallen off the wagon on doing that. But hopefully, I get back to exercising more. So.
So, what was the hardest part of dental school?
Oh man, dental school. I mean, honestly, dental school, I think it was pretty manageable. Now that I'm in the phase of building up my private practice, it's very difficult. I don't think dental school really gives you a lot of exposure in that. So right now I'm kind of feeling like, wow, like building up my practice is way more difficult than anything that I've done. But I guess if I had to pick anything from dental school, it would be probably studying for the boards and, the standardized exams. But yeah, I mean, still that I think is pretty manageable.
So, are there any tips for pre-dental students?
Oh, okay. So I definitely recommend getting into shadowing events such as this one, and try to befriend a dentist or someone in dental school to see, what their journey was like, what their experience was like. So basically, I would find a mentor who can answer your questions, and mentors who you can kind of shadow. And I guess my number one tip also is do really well in school, have a really good GPA, because dental schools definitely look at that before anything else, and also have a really high score on your DAT. But basically, to get your foot in the door, I would try to find mentors that are already in dental school or in dentistry.
So, I think that's all the questions we have. Thank you so much for being there and holding the session today.
Okay, you're welcome. Thank you. And for anyone that wants to ask me any questions, or look at my posts about, periodontal disease or any of the periodontal services I offer, you can look at my Instagram or Facebook. And if you have any questions about applying to perio programs or what perio is like in dental schools, you can email me at the email I provided. I am also going to be faculty at USC, a perio faculty. So if anyone has any questions, you can email me.
Thank you. Thank you so much.